Thank you for inviting me to this to present to this webinar. I will say hello to everybody, and also I take this opportunity to wish you all a happy Mental Health World Day, which is coming up on Saturday. So it's a good timing for the discussions that we're having. So I am going to spend hopefully 20 minutes, the next 20 minutes, to talk to you about loneliness and mental health and robots. Okay. So this slide shows that mental health matters to all of us. We could all have issues with mental health at any time, irrespective of our age or our ethnicity or our status of health or our gender.
Excuse me, can you please put your slides on full screen?
On full screen, let me see if I can do that. That's better, isn't it? Yes.
Yes, thank you.
That's good. Let's see if I'm going to keep this screen just in case it is because I made the screen larger before, and that's why you lost me. Well, I've talked about, you know, the issue about mental health, that it is something that we're all can be affected. And this is really to show you the link between loneliness and mental health. So loneliness can result in giving mental health problems, and obviously people who have mental health issues, they can't be lonely and isolated and so forth. We have loads of evidence from research to show that loneliness is bad for our health, not just our physical and spiritual and cognitive, but our mental health as well. So don't need to say anything more about that. I don't know if you can see this whole slide. Maybe I will try to show the whole slide. Maybe I'll do that. This is research that was done by the BBC in the UK a couple of years ago with 55,000 individuals to explore issues about and the meaning of loneliness from different perspectives. And these are the key messages that came out of that research. So loneliness is about feeling sad, feeling disconnected, feeling left out. And there's loads and loads of different causes of loneliness. So it could be disability or family breakdowns, discrimination, obviously mental health problems. And of course, these days, it is linked to COVID as well. And how many times have you heard either the TV programs or in social media or radio programs saying, talking about COVID and the consequences, the long-term consequences of COVID, especially in relation to our mental health, and for people of all ages. There is a great concern about the mental health of young people who have been isolating or suffering from the consequences of the lockdowns. So again, I think over the years, the research has looked at maybe some solutions in relation to loneliness, so to avoid the consequences, which is one of them are, as we said, mental health issues. And most of the a lot of the research points towards social contact and human contact and being part of social activities, nice welcoming neighborhoods and so forth. And that would alleviate the loneliness and the consequences of it. However, human human contact and interaction is not always there. Not everybody has friends and a good social circle. If you are an older person and you're living on your own or with your spouse, the likelihood of not having people to interact on a regular basis is there. Also, if you have any health problems, you may be getting some help from health and social care professionals, but again, that is becoming less and less, really, because families are not living near to each other. We know of all the demographics that are happening, the issues in relation to not only growing older, but having fewer younger people to enter the professions, the caring professions, and so forth. So we need to look for other solutions. And here where the robots come in. So let's bring our robot. Me with Pepper, the robot, that and we use this robot for the project that I'm going to talk to you about very briefly. It's a very cute robot, but let's just say that of course robots, artificial intelligence, devices, and so on are not acceptable solutions by everybody. There is still a lot of skepticism about that. People think that, well, if you send a robot to keep an older person company, that is devaluing the person. There are people who think that robots are scary or dangerous, and that and to the extreme that they would say that it is unethical to use robots in health and social care. Now, you could agree or not agree with that, but we've done quite a few reviews of the literature, and we have found that when you ask people and the research that has been done, there is more positive attitude than it is commonly and anecdotally being the myths are being that exist in our societies. Of course, robots are not the panacea for addressing loneliness and mental health and well-being. As I said, there is evidence that the technology is not bad for our health. In fact, it could be very helpful. And I think really the people that the team that I've worked with, we thought that it would be actually unethical not to explore the potential and the opportunities that the new technologies are affording us. We know that there is a lot of technology in other domains of healthcare, as in laboratories, surgical theaters, and we've heard some examples in this webinar today as well. But we wanted to look at the robots with helping in social care with older people. So the name of the project that I only have a few minutes to talk to you about is the Caressus Project, which was, as you can see there, funded by the European Union and the Ministry of Internal Affairs and Communications of Japan. So it was a European-Japanese collaboration. It was a multidisciplinary team, as you can see there, the different universities that took part. And we were we had two coordinators, one a Japanese one, and for the European team it was from the University of Geneva. We had we collaborated with SoftBank Robotics, who produces the Pepper robot, and with a UK company that has loads and loads of care homes named Advinia. And as you can see, we had a Swedish university and 2 universities from the UK. Now, what we wanted to do really is the issues of the demographic issues, the issues of oh God, my internet is unstable. I hope you can hear me, but area, and also more and more people who are in and independently moving entertainment, videos or films, play music, and people, the user with their loved ones very easily and efficiently. And so in terms of health promotion, there were we could encourage the user to exercise, to hydrate, to suggest nutritional food to eat, and so on. The third element was caring, for the user about hospital appointments, doctor appointments, taking medicine, and all of that really is related to because just because they were old people doesn't mean to say that they didn't suffer from depression, anxiety, and issues as well. So the whole project would actually be taken on board for everybody, but this is where we developed it, and we we did our trials. So the last element was safety and prevention. So because of all the homes or in the care homes, the robot is able to dictate if or the services. So just very quickly. So my role really, because this is the first culturally competent robot that has ever been created. And my role was, as some of you know, I have done a lot of work in cultural competence and compassion over the years. And I trained lots of humans to be culturally competent. So now I had to translate my work into a robot. So we started by creating a foundational pot of knowledge, cultural knowledge that was relevant to the 3 cultural groups that we were working with, which were the English, the white English cultural group, the Indian, the Japanese group. Obviously, we all know that not everybody who identifies with a particular cultural group is the same. We're all individuals, and we needed to avoid at all costs stereotyping people and just using like recipes to help them. We wanted to provide individualized personal care. So and all the elements that I have already explained. So that in my work came into that. So we used my theories and of cultural competence to create a new model, which also we've done a lot. We did a lot of observations in care homes. We interviewed people. We obviously all the research that goes with it. I will talk to you. I will first of all show you the culture generic information, how that was created. We developed this kind of diagrams. This is just one of them. And I'm just, you can't read it probably, but it's just there to show you the extent of detail and a holistic approach that we took into creating that that knowledge. In terms of the individualized specific information, we, like humans, human carers do, they have to ask questions if they don't know something, or if they're interested about the individual cultural characteristic of the person. So we developed this this model called the ADOR, and it has like 5 steps, and you can see the spiral. You ask. You complete a circuit, and then you go on to the next one and to the next one. And as the robot goes through all these spiral processes, the robot learns, and the robot stores in its memory information, specific and individualized information for the user that the robot is working with. So the robot assesses the needs of the user by asking questions in using the cultural knowledge, the generic cultural knowledge that it has, but in a sensitive way. Then the robot takes and does something. So it behaves, or it acts something with dignity and cultural compassion, obviously. Then the robot will observe the consequences of its action, and the response of the user, and will revise with the user the action that was taken, and then and the last step is to evaluate with robotic competence. So we started a new kind of area of work in nursing, which I call transcultural robotics nursing, hopefully we have published quite a lot of articles, and we have created a lot of videos, and they are all on the Caressus website. Also, you can find them by Googling us. And we are soon to start preparing a book about transcultural robotics nursing. So that is the model. I can talk for weeks on this, but obviously I'm just giving you a little flavor. I don't know how we're doing with time, but I do have a video which is 6 minutes long, which shows the autonomous learning robot having a conversation with different people. If we have time, we can show it, but maybe we can leave it at the end. So my take-home messages are that mental health can deteriorate due to loneliness, that loneliness and exclusion can result in mental health problems. And whilst human-to-human interaction is the ideal scenario, of course, not always, because sometimes humans can be quite toxic and not very helpful in the interaction. We need to look at the new technologies, we conducted the biggest trial of socially assistive robots with real people, with real users, and the results were that having a robot actually improve the user's mental health and well-being and reduce loneliness. So it was quite positive. I think our messages, our results. So we can't stop the progress, and technology is developing. It all, I think we have tried and we have shown, because the trial that we did, we compared a robot without the cultural competence element and with it, and the robot with a cultural element in it performed the best, and the results that I've just mentioned are coming from that. So really, nurses, healthcare professionals, mental health nurses, and mental health care professionals need to embrace the technological revolution which is upon us, and is growing and at a very, very fast rate. And to make it work for us, we need to be part of those teams of the artificial intelligence and robotics engineers. We need to be part of companies that are looking to develop healthcare AI devices, and really having some influence and definitely a lot of input. And it's good that we've talked a lot in this webinar about co-production and how successful it can be and how helpful it can be in devising technological solutions and other solutions that are really very useful. So my conclusion is that I believe that there is a place of artificial intelligence and robotics in mental health, and that I will leave it to that. Thank you very much for listening, and if we do have some minutes, it would be nice. The video is very nice and you will enjoy it, but I'll leave it to the coordinators to decide.